I feel that universal healthcare, but also what Rahul mentioned in the survey was that there's a lot of out-of-pocket expenses. So I can't just, I can't, reconcile those concepts. But also, I think there were some studies before saying that the poorer don't really access PhilHealth as much as the richer ones. I mean, those who are more educated or those who have access to information use their PhilHealth or tap their PhilHealth, but then the ones where, they say the laylayan, they are not aware of those, the insurance coverage that PhilHealth extends to us. So what do you think could be done to, to address that gap between, in spreading information about our access to, universal healthcare, that we're supposed to enjoy that for free? Thank you.
Okay. Uh, yes, I'll follow you.
So I think the only thing that I had to say is that PhilHealth and even HMO for that matter has limitations to the benefits available to customers. And a lot of time when we talk of out-of-pocket expenses, it can you can have an out-of-pocket expense even if you have these kind of support systems because your treatments cost much more than what the coverages are available. So that gap between what PhilHealth provides or an HMO benefit provides and even some of the private insurers provide and what you end up spending, that delta is what is an out-of-pocket expense. Of course, when some of these things are zero, then the out-of-pocket expense is even more. But even for customers who have access to these kind of benefits, there is still an out-of-pocket expense because of continuous medical inflation. These prices and the cost of getting these treatments is going up on a year-on-year basis, and these benefits are not able to catch up. And a lot of time, customers don't even tally those things up. They don't even do that maths that they really have enough coverage which will help them to get treated on some of these medical expenses.
Dr. Taya?
Okay. The thing about out-of-pocket expense is that it is always uncertain, but it is a reality because health facilities are not like a shoe store wherein if you look for your size, most of the times they have the right size for you. So imagine you are in a hospital wherein you needed surgery for a fracture and you need those pins and screws and plates and the hospital doesn't have the right size for you. So they have to outsource it and you have to pay. That's an out-of-pocket expense. It's not because the hospital didn't want you to make sure that it's affordable for you because you are a member of PhilHealth, but they don't have the inventory for all of this. So that kind of situation uh, makes you a person that is now in danger of, for example, paying the bills, getting loans, or writing a promissory note. And so, aside from the field help, there are other sources of funds. And in fact, the Department of Health has introduced the no balance billing, meaning for the indigent patients, they leave the hospital without paying a single cent, no balance billing. But this is not for everyone. That's why in my presentation, there's a role for private insurance companies like Manulife and the other sources of funds, savings, loans, and of course, the best investment is that you protect yourself from this harm by having a healthy lifestyle. It can uh, get rid of the expenses that can be a nightmare to you.
Okay. We have.
Hi, sir. Rafi Aing from the Daily Tribune. Sir, how can poor citizens can be urged to avail health and life packages being offered by players, including Manulife, especially when they are struggling to make ends meet?
So as I mentioned earlier, I think for us there are a couple of things that we're doing. One, we are partnering with digital ecosystems where, because one of the expenses of our products is distribution expense, which is brought down significantly if we partner with digital ecosystems like Gcash. So if you go to Gcash today, you can get even something like a dengue cover for yourself at a very, very cheap price. So we are working with some of these digital ecosystems to provide access to simple insurance covers to customers, which then brings or deals with that affordability as a challenge. And I think that is one very important step that we have seen is providing coverage to a much larger population than what traditionally we've been reaching out to through our traditional channels of distribution of agents and all. So that's one thing, one initiative that we have. And also then we are making the products simpler and more specific, which then makes it cheaper. And it's more like a sachet kind of a thinking or mentality, which then again brings the affordability of the product to what we want.
Okay.
Good morning. My name is Alden Manzon from the Philippine Daily Inquirer. My question is to Sir Rahul. Sir, what are the implications on the Philippine insurance industry of your findings that young people are getting sick at higher rates? Do you expect this demographic to be the market driver in the coming years? And also, do you think insurance firms such as yours should tailor fit their products to this demographic, like more flexible or cheaper premiums?
Yes. So the cheaper part I talked about earlier, but exactly to your point, even if you look at the overall demographics of Philippines, right, we have a very, very young population. And hence, we as an insurance company are always, through our product design, through our communication strategy, through the propositions that we provide to our customers, we are targeting these customers in that age bracket. Because if you are starting early, and not only by just buying the products, but the advocacy that we are bringing to our customers through partnerships and through speakers like we have today, and through all the partnership that we have with all of you in the media, we want to ensure that Filipinos at younger ages start developing the right habits and start developing the right lifestyles, and of course, starts investing in some of these products, because if you start early, then there is a high chance that you will be much better prepared to deal with any future uncertainties, which then also leads to lesser stresses in the future. Right? So to your point, yes, this is our target market, and we really are focusing a lot through all angles to reach out to this target market with our advocacies.
Sir, but are they actually the largest portion right now, or is it still more?
Not right now, but we are seeing an increasing trend with the increased awareness that these age group customers have.
Thank you, sir.
Thank you.
All right, we have time for just one more question, sir. Yes.
Hi, good afternoon. My name is Rory from Business Mirror. Regarding the slide that you presented, Dr. Tay, actually this is a question for Dr. Tayag and Erwan. Regarding the slide that live to eat and eat to live, the fact remains that ingredients that are needed to make healthy food is becoming more expensive compared to the unhealthy ingredients that we are trying to avoid. So how can I get your insights on that, sir?
Okay, maybe Erwan can start first as I collect my thoughts. Although I also cook.
So yeah, I think definitely, especially over the last 12 months, we've seen dramatic increases in the base price of products across different cities in the country and in wet markets and in supermarkets. So I think it comes down to once again, what I said is there are two aspects. Is one, it's kind of decolonizing how we see food in general, decolonizing our own food. I've had people say to me, I'm trying to eat healthy, but I can't afford it, and then I see them eating like a takeaway fried chicken or something like that. But if you were to make, I don't know, something with saruyot at home, broth based, per portion it actually comes down to be more affordable. So I think that's where information and education is key when it comes to learning how to use products that have traveled less miles to get to our plates. So hopefully have less margins and have less logistical costs on them, and trying to shop as locally as possible. This is a bit more easier when you're in the province because you have straighter access to ingredients and produce. There, we work with a lot of organizations under Future with different farming associations in the country, and we're throwing away so many vegetables and so much of our produce because no one's actually using it. So I think it's really important to, wherever you live, kind of figure out what's being grown and understand where and when you can buy it. And then again, changing that perspective of what we have as Filipino food. Like I said, if you eat something like sinigang or tinola na isda, like something that you can do for not a huge budget, like in every fishing community, everyone eats fish tinola, right? Because it is one of the cheapest things to do. All you need is water, maybe some tomatoes, some green chilies, and whatever cash of the day you got, whether it's a big fish or a small fish. That is extremely healthy. The problem is when you eat that with 6 cups of rice, right? Or when you eat that with something else inside or with a dessert or something like that, that's when things start getting unhealthy. So it's really just changing that perspective of what healthy food is. Filipino food, pre-colonial Filipino food, there's a lot of good stuff. It's just realizing that one, it's healthy, and two, how to cook it at home. And so you can kind of try to bridge that gap between expenses and nutrition.
Thank you.
Okay, there's always eggs. Although we have to monitor the
High
prices.
cholesterol, no?
Yeah, no, that's a wrong notion. Okay,
The
Beatrice
egg
will
yolk.
tell you why it's a wrong notion. Second, you just have to learn how to cook. Because if you know how to cook, then you want to make sure you get the right ingredients and that these are affordable. The problem is, most families will not cook anymore, especially those living in condominiums, for example, there's the microwave. And so these are all processed stuff. And I was listening earlier to Erwan when we were in another room. He mentioned about laswa. And it's my favorite dish, laswa. No oil, you just have this water to boil and all the vegetables that you want included in there. Maybe throw some small shrimps. But what I've learned is that families should learn how to cook. Because if you're that kind of person who goes to your neighbor and going back from work, you've eaten outside, then you have taken all the risk for an unhealthy diet. You really have to cook. And when you cook, there's love. And so you get two things, love and health.
And the workout.
Thank you.
I always sweat when I cook.
John, the workout.
Yeah, you're standing. It's not easy. Beatrice, would you like to add something quick from the point of view of an R&D?
Yeah, so earlier, also the misconception about eggs, they were saying that it's high cholesterol, it's not.
Yes, we have to defend eggs today before we wrap up.
They're actually known to be the complete protein. So, also, if you live in the province or even in the condominium, you can actually plant. Yeah, so you could plant vegetables in there, and then, if you live in a condo, then you could plant something just for yourself, herbs, tomatoes, and even malunggay. You could plant that so that it cuts down on the cost, and also your options are healthier as well. So those are just my 2 cents about it.
All right. Thank you, Beatrice, Dr. Tayag, Erwan, and Rahul. I think that wraps up today's chat. Of course, thank you so much for sharing your expertise, your anecdotes, your experience, and your insights with us.
Oh yeah, dito na next.
And to our media friends, thank you so much for your presence. If there are any other questions that we have not